The fluorescent lights of Mercy General's trauma bay had a particular cruelty to them. They washed out skin tones, flattened shadows, and illuminated everything with the cold indifference of a surgical lamp, including the expression on Dr. Marcus Aldridge's face as he turned on the young woman standing at the foot of bed 3. "You don't know SHD, BTCH. The words landed in the crowded trauma bay like a scalpel dropped on a tile floor, sharp, metallic, impossible to ignore. A nurse froze mid-reach. A first-year resident looked away. 3 patients in adjacent bays went very quiet. The young woman at the foot of bed 3 did not flinch. She was 22 years old, small-framed, wearing scrubs that were slightly too large for her shoulders. Her dark hair was pulled back with the kind of ruthless efficiency that suggested she had learned to do it in under 15 seconds and in the dark. Her face was, and this was the thing that would bother Dr. Aldridge later, in the weeks after everything unraveled, completely, unnervingly calm. Not the calm of someone who had shut down. Not the blank mask of a person absorbing a blow. Something older. Something that had looked at worse things than Marcus Aldridge and found them, ultimately, manageable. She said nothing. She looked at the patient's chart in her hands, made a small notation, set it back in its slot, and stepped back exactly 1 pace to give the attending physician access to the bedside. Dr. Aldridge didn't notice any of that. He was already moving on, already barking orders at someone else, already convinced that the intern in the oversized scrubs was exactly what she appeared to be. Nobody. He would spend the rest of his career trying to forget the moment he found out how wrong he was. Her name, in the Mercy General system, was listed as Evelyn R. Hartwell, intern, class of 2024, MD candidate from Johns Hopkins. 22 years old. 5'4". Blood type O negative, which she had always thought was a fitting irony. The universal donor, the one whose blood could go anywhere and be received by anyone, the one who asked nothing back in return. She had been at Mercy General for 6 weeks. In those 6 weeks, she had been yelled at 7 times by Dr. Aldridge, assigned the worst night rotations 4 times, had her name mispronounced twice at morning rounds, once genuinely, once, she was fairly certain, on purpose. She had been handed a cup of coffee that she hadn't ordered and then been blamed when it was the wrong temperature. She had been told, on separate occasions, that she asked too many questions, that she was too quiet to be useful in an emergency, and that she clearly chose the wrong profession. She had not argued with any of it. Dr. Sarah Chun, who occupied the locker next to hers in the intern changing room, found this baffling. "How do you do that?" Sarah asked on a Tuesday morning, watching Eve pull on her white coat with the same expression one might wear while checking the weather. "How do you just stand there and take it? He called you AB*TCH in front of like 20 people." Eve looked up. She had very steady eyes, dark brown, the color of good soil, the kind that had seen enough rain to know it would dry eventually. "It doesn't matter." "It does matter. It absolutely matters. It matters for workplace dignity, and it matters for—" "Sarah." Eve smiled, and it was a real smile, the kind that reached those steady eyes and softened them briefly. "It doesn't matter." Sarah stared at her. "You are either the most mentally healthy person I've ever met, or the most broken one, and I genuinely cannot tell which." Eve considered this. "Maybe both," she said, and picked up her pager. She was good at her job. This was the thing that nobody who watched Aldridge berate her would have guessed, because Aldridge was so loud and so certain and so present that his contempt for her seemed to carry the weight of institutional truth. But the nurses knew. Ruth Dawson, who had been running Mercy General's ER for 19 years and who had seen approximately everything that medicine could throw at a human being, had noticed the intern in the oversized scrubs within her first week. The way she read an EKG, not studied it, not worked through it, but read it. The way a musician's sight reads a piece they have never seen before and immediately knows where it is going. The way she moved around a crash cart with the fluid efficiency of someone who had performed the same motions under conditions far more difficult than a brightly lit American hospital. The way she stood during a code, not scrambling, not panicking, watching, cataloging, and then, when she acted, acting with a precision that had no business being in a 22-year-old intern. Ruth had not said anything to anyone. She was a woman who had learned, over 19 years, that there were 2 kinds of people who stayed quiet about what they knew. Those who had something to hide, and those who had something to protect. She had filed Eve away in the second category and kept watching. There are things that only come out in the spaces between one emergency and the next. Eve found those spaces in the hospital's rooftop garden at 2 a.m., when the city spread out below like scattered embers, and the air was cold enough to remind her that she was still alive and present in her body. She would sit on the low concrete wall, not dangerously close to the edge, just close enough to feel the altitude, and let the memories surface and pass the way she had learned to let them. Sand. The smell of burning fuel and copper. The sound a man makes when he realizes someone is going to save him and he doesn't know how to process the relief. The weight of a chest retractor in her hands at 19 years old, 3,000 miles from Johns Hopkins, in a field surgical unit that officially did not exist in a country she was officially not in. She had been 17 when she was recruited. Not unusual. Technically, the military had scholarship programs, ROTC, all manner of mechanisms to catch exceptional young people early. What was unusual was the program that had found Evelyn Hartwell, a classified pipeline designed to identify candidates with extraordinary manual dexterity, exceptional spatial reasoning. And this was the part that still seemed implausible to her when she thought about it. An unusual neurological capacity for performing complex tasks under extreme stress without degradation of fine motor control. In plain English, her hands did not shake. They had tested her in every way they could design. Loud noises, extreme temperatures, sleep deprivation, simulated combat scenarios. Her hands performed identical procedures with identical accuracy at hour 1 and hour 27. The program's chief assessor had written in her file, in language that was uncharacteristically lyrical for a military document. This candidate's relationship with crisis is unlike anything we have previously documented. She does not fight the chaos. She lives inside it. She had spent 5 years inside it. 3 tours. 47 documented saves in conditions that other surgeons would have classified as unsurvivable. A distinguished service cross that she kept in a small velvet box in the back of her locker, beneath a spare pair of scrubs and a paperback copy of Blood and Guts, a history of surgery that she had read 4 times. 2 additional combat action decorations. A classified commendation from a senior official whose name she was not permitted to share for a surgical procedure she had performed in a cave in the dark using a headlamp and instruments that had been field sterilized with alcohol from a first aid kit. She was 22 years old. She was also, as her official Johns Hopkins records accurately stated, an intern in her first clinical rotation, with no prior hospital experience, who had completed her medical degree through an accelerated program that the military had arranged, and that raised no flags because the military was very good at arranging things that raised no flags. She was nobody. She preferred it that way. The Tuesday morning rounds that would eventually be remembered as the last normal morning at Mercy General began like every other Tuesday morning, with Aldrich holding court. He was a tall man, silver-haired in a way that photographed well, with the particular confidence of someone who had been the smartest person in most of the rooms he had entered for the past 30 years and had stopped questioning whether this would continue. He was a genuinely skilled surgeon. This was important, and Eve had never lost sight of it. His hands were good. His instincts were solid. His record was impressive. He was also cruel in the specific, targeted way of a man who had never been properly challenged and had come to mistake cruelty for rigor. Hartwell. He did not look up from the chart he was holding as he addressed her. Around him, the resident team shuffled slightly, the way a group of animals will shuffle when a predator focuses on a specific target. Tell me what's wrong with the patient in Bay 7. Eve had read the Bay 7 chart at 6 a.m. She had read all the charts at 6 a.m. This was not required of interns. This was something she did because old habits were deeply encoded. Mr. Kowalski, 68, presenting with chest pain and shortness of breath. He was assessed for STEMI and started on aspirin and heparin. She paused. The EKG from this morning shows a new right bundle branch block that wasn't flagged in the overnight notes. Combined with his JVP elevation and the absence of orthopnea, I think the differential should be broadened to include acute cor pulmonale. I'd want to rule out pulmonary embolism before continuing anticoagulation at the current dose. There was a silence. Dr. Theodore Marsh, standing at Aldridge's left elbow with the expression of a man whose primary goal in any given situation was to agree with Aldridge, gave a short, dismissive laugh. P. In a 68-year-old with no prior DVT history and no recent surgery? He had a knee replacement 8 weeks ago, Eve said. It's noted on page 3 of his intake form. Another silence. This one had a different quality. Aldridge looked up from the chart. He looked at Eve. His expression did what it always did when she said something accurate that he had missed. It tightened, briefly, before reassembling into contempt. I'll decide what the differential is for my patients, Hartwell. Not you. Do you understand? Yes, she said. Good. Marsh, let's move on. They moved on. Mr. Kowalski in Bay 7 was scanned that afternoon, after a second nurse flagged the same concern Eve had raised. He had a massive bilateral pulmonary embolism. He survived because the scan caught it before the anticoagulation tipped into a hemorrhagic event. Aldridge signed the order for the scan. His name went on the chart. No one mentioned the intern who had been told to be quiet 2 hours earlier. Ruth Dawson watched from the nurse's station and said nothing. But she pulled Eve's locker assignment and made note of it, and she began, quietly, to pay a different kind of attention. It arrived on a Thursday afternoon in October at 2:47 p.m. in the form of a radio call. Mercy General, this is EMS Unit 14. We have a multi-vehicle collision on the I-78 bridge. Approximately 32 casualties, triage ongoing. First transport's ETA 7 minutes. Repeat, 32 casualties, multiple critical. The trauma bay, which had been running at normal capacity, shifted. It was a physical thing. The shift, like a pressure change before weather, like the specific quality of air that precedes lightning. Nurses began moving faster. Residents reached for gowns. The PA system sent out the mass casualty protocol code. And within 3 minutes the ER had transformed from a busy hospital into something that more closely resembled a battlefield staging area. Dr. Aldridge took command of the entrance. This was appropriate. He was the trauma department head, and in mass casualty situations, command structure existed for a reason. He was loud, decisive, and visible, which were 3 things a team needed in chaos. Eve did not quarrel with his right to be in charge. She simply began doing the other things that needed doing. The first transport arrived. 3 critical patients. While Aldridge directed the most visually dramatic case, a man with traumatic amputation of the lower left leg, who was critical but, to Eve's assessment, stable enough for 30 more seconds. She moved to the gurney that the paramedics were wheeling past without urgency, flagged as minor, monitor. The woman on that gurney was 51 years old, had a seatbelt contusion across her chest, and was breathing in a pattern that Eve recognized before she had consciously processed what she was seeing. 15 minutes later, without that intervention, the woman would have been in tension pneumothorax. Eve requested a needle, performed the decompression, and moved on before anyone had noticed she had done it. The second transport. 5 patients. The 4th bay was receiving a man with a head injury who was being managed conservatively, appropriate. If his pupils had been equal and reactive, which Eve checked over the resident's shoulder and found that they were not. His left pupil is fixed and dilated, she said to Dr. Emily Foster, who was managing the bay. Foster looked again, swore softly. Neurosurg, stat, she said to the nurse, and shot Eve a look that was not quite gratitude but was moving in its general direction. The third transport. 7 patients. Aldridge was now stretched across multiple bays, his voice rising with each new arrival, his commands beginning to carry the slightly rough edge of a man who was managing more variables than his system had been designed to handle simultaneously. We need another attending on the floor, he shouted at no one in particular. Dr. Marsh is in Bay 5, a nurse called back. Where the hell is Voss? Dr. Voss, the chief of medicine, was 48 years old, calm, and at that moment walking through the ER doors in response to the mass casualty alert. She took one look at the floor and began making rapid assessments with the cool competence of a woman who had been doing this for 20 years. She also noticed, because she was the kind of person who noticed things, that the intern with the steady eyes seemed to be everywhere and nowhere simultaneously, appearing at a bedside, making a brief intervention, disappearing before attribution could occur. Voss filed that away, said nothing, and joined the flow. At 4:19 p.m., the last transport arrived. It was not the largest vehicle or the noisiest entrance. It was a single black SUV with government plates, flanked by 2 dark sedans that had clearly been running at speed for some time. It pulled up to the trauma bay entrance with a controlled urgency that was different from ambulance urgency, more deliberate, somehow more frightening. Two men in military dress uniform got out first, then the paramedics, then the gurney. The man on the gurney was in his early 60s, broad-shouldered even in the flat posture of the critically injured, his uniform jacket cut away, his chest bearing a wound that made two of the nurses inhale sharply. A penetrating chest injury, left thoracic, with the specific clinical picture of cardiac tamponade. His pressure, the paramedic called out, was 60 over palp. His heart rate was 140 and thready. His oxygen saturation was 84% and dropping. He was also, Colonel Hayes confirmed in a voice like iron, General James Calloway, chairman of the Joint Chiefs of Staff of the United States Armed Forces. The trauma bay did not stop. It was a professional environment, and professionals do not stop. But there was a perceptible shift in the quality of the movement. A different kind of adrenaline. Aldridge arrived at the bedside within 20 seconds. He looked at the injury. He looked at the monitor. He looked at Marsh, who had appeared from Bay 5 with the expression of a man hoping someone else would make the decision. Cardiac tamponade, left hemothorax, Aldridge said. His voice was controlled, but Eve, who had moved to the periphery of the gathering and was watching with the specific focused attention she reserved for things that were about to go wrong, could hear the slight compression in it. The tightness. BP is too low for the oar. He'll arrest on the table. So what do we do? Foster asked from behind him. We stabilize. We push fluids, Fluids will worsen the tamponade, Eve said. She had not intended to speak. She had been standing at the back. But the words came out with the flat, factual certainty of a woman stating the temperature of a room, and they were correct, and in the silence that followed, she could not unsay them. Aldridge turned. He looked at her with an expression that had moved beyond contempt into something more personal. Nobody asked you, Hartwell. He needs an emergency thoracotomy, she continued, because she was past the point of stopping now, and because the man on the gurney had perhaps 6 minutes. Pericardial decompression and direct cardiac repair. Fluids will temporarily raise his pressure, but increase the tamponade compression rate. You'll buy 4 minutes and lose 10. An emergency thoracotomy on a patient with a BP of 60 has a 15% survival rate in penetrating cardiac trauma if performed within 6 minutes of the pressure drop, Eve said. Which was, she looked at the monitor's timestamp, 4 minutes and 20 seconds ago. The trauma bay had gone very quiet. Not the quiet of people not working. Hands were still moving, monitors still beeping, but the quiet of a room in which something was happening that everyone understood was important. Aldridge stared at her. His face was cycling through several things. You are a first-year intern, he said. You have done nothing that qualifies you to. Then you do it, Eve said simply. I'll assist. More silence. Marsh cleared his throat. Marcus, the BP just dropped to 55. Aldridge looked at the monitor, looked at the patient, looked at the assembled team, all of whom were looking at him, waiting for a decision that would define the next 6 minutes, and, quite possibly, this man's life. He started. I'll take him, Eve said. She did not raise her voice. She did not put authority into it or challenge into it. She stated it the way she had stated everything, with the flat, simple confidence of someone reporting a fact. I will take this patient. You most certainly will not. Dr. Aldridge. Ruth Dawson was at Eve's elbow. Ruth, who had said nothing across 19 years when senior physicians were wrong, who had kept her assessments to herself and her opinions in folders, and her knowledge in the careful architecture of professional deference, was standing at Eve's elbow with a set of surgical gloves held out. Size 6. Small hands. Let her, the way she said it. Not let her try. Not give her a chance. Not the provisional language of someone making a gamble. Let her. Like she knew something. Like she had always known something. Aldridge looked at Ruth. Ruth looked at Aldridge. On the monitor, the general's BP ticked down to 52. This is, Aldridge began. I need a thoracotomy tray, a rib spreader, pericardial scissors, and 3-0 proline suture, Eve said, pulling on the gloves. And I need everyone who is not actively assisting to step back. Chapter 6. The Operating Theater. The silence in the trauma bay during the next 41 minutes was a different kind of silence. It was the silence of held breath. Eve worked. Later, when people tried to describe what they had witnessed, they struggled with the vocabulary. Foster, who had been the one to thread sutures on Eve's request, and who had therefore been the closest, would say later that it was like watching someone play an instrument they had built themselves. Ruth, who had stayed at the supply cart and had anticipated 3 separate instrument requests before they were verbalized, would say simply, "I have worked with the best surgeons in this hospital for 19 years. I know what good hands look like. Those were different." The medical facts. Eve performed an emergency left anterolateral thoracotomy with pericardial decompression in 41 minutes, under conditions that included a patient with a BP nadir of 48, 2 episodes of near arrest requiring internal cardiac massage, and a complex left ventricular laceration that required sequential suture repair in a field compromised by ongoing hemorrhage. The technique she used for the ventricular repair was one that 2 of the attending surgeons, reviewing the operative notes afterward, identified as a modification of a technique used primarily by military trauma surgeons in field conditions. Not the kind of thing taught in standard residency programs. Not the kind of thing a first-year intern from Johns Hopkins should have known. The human fact. General James Calloway's heart was beating on its own at 5:01 p.m. Strong, steady, under repair. Eve stepped back from the table. Her gloves were red. Her expression was what her expression always was. Calm. Present. Not triumphant. Not drained. Not overcome. Simply here, in the way that a person who has been in worse places is always simply here. Aldridge had not moved from the doorway of the trauma bay for 41 minutes. He had watched the whole thing. His face, by the end, was the color of the hospital walls. General James Calloway regained consciousness at 8:34 p.m. He had been moved to a private room. The hospital had cleared an entire wing within 30 minutes of his identity being confirmed, which was a thing that hospitals could apparently do when sufficiently motivated. Colonel Hayes had been in the chair by the door since 5:30. Mrs. Margaret Calloway, who had been in one of the other vehicles in the convoy and had been brought to the hospital with minor injuries of her own, was in the chair by the bedside, holding her husband's hand with the careful grip of someone who had learned, over many years, how to be present without hovering. He opened his eyes slowly. The overhead lights had been dimmed. The monitor beeped its steady rhythm. Outside the window, the city had gone dark. His gaze moved across the room systematically. The ceiling, the monitor, his wife's face, the door, the window, the automatic perimeter sweep of a man who had been in dangerous places and whose nervous system had encoded that check so deeply it persisted even through anesthesia. Then his gaze returned and stilled. The intern in the oversized white coat was at the door, checking his chart. She had been making the rounds since his transfer, every 40 minutes, quiet as a draft under a door. She had not expected him to be awake. He looked at her for 3 seconds. Then he said, in a voice roughened by the intubation tube and 40 years of command and something that was currently very carefully controlled, "Captain Hartwell." The room changed. Margaret Calloway looked up from her husband's hand. Colonel Hayes rose from his chair in one motion, the way military personnel rise, the instantaneous transition from seated to standing that civilian bodies rarely managed. On the monitor, the general's heart rate, which had been a steady 64, ticked briefly upward. Eve looked up from the chart. She was very still for a moment. Then she said, quietly, "General, you're here," he said. It wasn't a question. There was a quality in his voice, not surprise, exactly, more like the specific emotion of someone who has been told a mathematical theorem and then watched it prove itself. "Of course you're here. I'm an intern," she said. "First rotation. You're the person who just opened my chest and repaired my heart." His voice was dry, and beneath the roughness there was warmth moving through it like light through water. "I've been debriefed." Hayes pulled the surgical notes. Hayes, from his position by the door, nodded confirmation. His expression had the particular quality of a man who was working very hard to maintain military composure while also experiencing a series of strong emotions. "The patient's information will be in your chart, sir," Eve said, with the exact inflection of an intern discussing a post-operative case. "I'll let you rest." "Hartwell." He said her name the way he had said it 2 years ago, in a military field hospital in a location she was not authorized to confirm, when she had appeared beside his gurney at 2 in the morning and he had understood, even through the fog of blood loss, that someone extraordinarily capable had just taken responsibility for keeping him alive. "Come here." She came to the bedside. Margaret Calloway watched her husband with the expression of a woman who had learned, over 33 years of marriage to this particular man, to read him the way other people read weather patterns. She watched him look at this young woman, this small, quiet, 22-year-old in a coat that didn't fit her, and she saw something pass across his face that she had seen very few times, something like reverence. The general reached out. His left arm was compromised by the four-line and the cardiac monitoring leads, so he used his right arm, which had been injured in the convoy ambush and had been treated for a radius fracture and was immobilized in a splint. He reached out with this compromised, splinted, painful arm, and he took Eve's hand. He turned it palm upward. He brought it, slowly, to his lips. He kissed the back of her hand. It was not a gesture from any contemporary vocabulary. It was something older, the kind of gesture that had existed in a time when the acknowledgement of an extraordinary debt required an extraordinary expression. In the French tradition, it was la baise-main, and it meant nothing romantic. It meant I recognize what you have done, and I am not adequate to the repayment, but I will not pretend I don't owe it. General James Calloway, chairman of the Joint Chiefs of Staff, for stars, 35 years of service, kissed the hand of the 22-year-old intern and held it for a moment before setting it gently back. In the doorway, Colonel Hayes, who had served with this man for 11 years and had seen him decorate soldiers and address presidents and stand at the graves of friends, blinked once. Hard. Margaret Calloway had tears on her face. Eve stood very still, and her expression was the only thing it could have been, exactly itself. News in hospitals travels the way disease travels, faster than anyone plans for, through the ventilation systems of human conversation, carried in brief exchanges at the nurse's station and in glances across the ER floor, and in the particular speed with which people who have witnessed something significant find reasons to be in the presence of other people. By 9 p.m., the story had traversed Mercy General's 4 floors. The intern saved him. Aldridge said he was unsalvageable. She did a thoracotomy. A thoracotomy. She's a first year. The general called her Captain. Captain. Sarah Chen found Eve in the stairwell between the 2nd and 3rd floors, which was where Eve apparently went when she needed to be nowhere in particular. She sat down beside her on the concrete step without saying anything for a moment. Captain, Sarah finally said. Captain Hartwell. It's Dr. Hartwell now. In this context, Eve leaned her head back against the wall. She looked tired, not the broken-down tired of someone who had been through too much, but the clean tired of someone who has used exactly the right amount of themselves. I switched contexts. Eve. Sarah turned to look at her profile. Who are you? It was such a direct question, and asked with such genuine warmth, that Eve was quiet for a moment with something that was not quite sorrow and not quite relief. I'm your colleague, she said. That hasn't changed. But the other thing. The captain thing. How? Eve turned to look at her. Those steady eyes. Do you remember when you asked me once how I stay so calm when Aldridge screams at me? You thought maybe I was either the healthiest or the most broken person you'd ever met. I remember. I've worked in places where the thing trying to kill my patient wasn't paperwork or professional politics, Eve said. It was actual weapons. And I had to keep my hands steady regardless. She paused. Aldridge is a very loud man in a very safe building. I don't mean that as an insult to him. It's just a matter of calibration. Sarah stared at her for a long moment. Then she said, I think you might be the most incredible person I've ever met, and you've been letting that man call you AB*TCH for 6 weeks. Eve's expression shifted, briefly, into something that was almost amusement. It genuinely doesn't matter, Sarah. It matters to me. Eve considered this. All right, she said. Then I'm sorry you had to hear it. Sarah made a sound that was something between a laugh and a sob. That is not the apology I was looking for, and you know it. I know. Eve stood, smoothed her coat. I'm going to check the general's vitals again at 10. Do you want to come? Sarah stood too. I want to know everything, she said. Everything. You can tell me in increments if you need to, but I want all of it eventually. Eve looked at her. The stairwell light was the same indifferent fluorescent as the rest of the hospital, but something in Eve's expression in that moment, some very small softening around those steady eyes, made it seem, briefly, warmer. Eventually, she agreed. Colonel Daniel Hayes was not a man given to speeches. He was 39 years old, had served 2 wars and 1 classified engagement, and communicated in the compressed, precise language of someone who had learned that words, used carelessly, cost lives. He was also, in this moment, standing in the middle of Mercy General's primary conference room at 10 a.m. the following morning, having requested the meeting, having ensured that both Dr. Aldridge and Dr. Voss were present along with 5 other attending physicians, for nurses including Ruth Dawson, and the group of interns who had been on rotation during the mass casualty event. He had a folder under his arm. "Thank you for your time," he said. His voice was the same flat iron it always was. He set the folder on the conference table. "I've been asked by General Calloway to provide context regarding the physician who performed his emergency surgery yesterday evening." He felt that context was appropriate given some of what occurred during the events preceding the surgery. A pause. He was very precise about that last part. Aldridge shifted in his chair. His expression was the expression of a man who had arrived at this meeting with a prepared argument and was beginning to sense that the argument was not going to be useful. "Dr. Evelyn Hartwell," Hayes said, "is listed in the Mercy General system as a first-year intern completing her initial clinical rotation. That is accurate and not inaccurate. However, it is incomplete." He opened the folder. "What I am authorized to share with this room, given the circumstances and with the approval of the relevant oversight body, is as follows." He read. He read it in the same flat, iron voice, without emphasis, without drama. He did not need to provide either. At 17, Evelyn Hartwell was recruited to a classified Department of Defense Medical Talent Identification Program, following exceptional performance on standardized surgical aptitude assessments. She completed an accelerated pre-medical curriculum at 19, while simultaneously completing basic military medical training. Between the ages of 19 and 22, she completed 3 operational tours in support of classified special operations missions, serving as primary surgical officer in field conditions. During this period, she performed 47 documented surgical interventions in active conflict zones, with a survival rate of 91% in cases classified as critical or unsurvivable upon presentation. She received the Distinguished Service Cross for actions during Operation. Hayes paused briefly, the name of which remains classified. The citation notes that she performed a 7-hour surgery under direct fire, without adequate instrumentation or anesthesia support, and saved the lives of 4 personnel who would not otherwise have survived. She received the Bronze Star with Valor for a separate incident. She received the Combat Action Badge on 3 separate occasions. She was honorably discharged at the conclusion of her service obligation and enrolled at Johns Hopkins School of Medicine, where she completed her MD in an accelerated program. She is 22 years old. Hayes closed the folder. The room was very quiet. Aldridge's face had passed through several stages and arrived at something that was not quite an expression, something that happened when the brain encounters information that it has no existing framework to process. Ruth Dawson, at the far end of the table, was looking at her hands in her lap, and the expression on her face was the expression of someone who has been quietly right for a long time and does not, in this moment, find it satisfying. Only sorrowful, and just, and complete. Dr. Voss had not moved. She was looking at the folder on the table with the expression of a woman who was reorganizing a significant body of information. Sarah Chun, who was sitting 2 seats from Eve, looked at Eve. Eve was looking at the middle distance. Not at Aldridge, not at Hayes, not at the folder. At the space where none of this drama existed, where things were simply what they were. Aldridge opened his mouth, closed it. "She is," Hayes continued, and his voice in the silence was like a door closing. "The person who has now saved General Calloway's life on 2 occasions. He considers the debt unpayable. He is, however, a man who prefers to begin paying his debts immediately." He looked directly at Aldridge. "He asked me to ensure that the record was correct, that the record fully reflected the events of yesterday, including events prior to the surgery." The meaning was unmistakable. Aldridge looked at the folder, looked at Hayes, looked, finally, at Eve. Eve looked back at him with those steady, dark eyes. Not triumphant, not cold, not angry, simply present, the way she was always present. The way a person is present when they have been in rooms where the stakes were much higher than this and have learned that presence, simple presence, is the most honest response available. Aldridge said. Dr. Patricia Voss requested a private meeting with Dr. Aldridge at 2 p.m. She also requested the HR file. She had, In the 6 hours between Hayes's disclosure and that meeting, reviewed the complaint logs from the nursing staff, 3 filed, 2 withdrawn under what was becoming apparent as professional pressure, the rotation assignments for all interns over the past 18 months, and a pattern of documented incidents that, individually, might have seemed minor, but together described something that Voss was not willing to tolerate in her hospital. The meeting lasted 1 hour and 40 minutes. What was said in that room remained between the parties and the HR documentation. What was publicly known was that Dr. Marcus Aldridge tendered his resignation from the department head position the following week, citing a desire to pursue other opportunities, and that the position was posted internally before the week was out. What was also known was that on the afternoon following Hayes's disclosure, Aldridge appeared in the corridor outside the attending lounge where Eve was updating patient notes. He stood in the doorway for a moment. She looked up. There are apologies that are adequate and apologies that are not, and everyone in the room knows the difference between them. Dr. Hartwell, he said. His voice had lost several of its characteristic qualities, the command, the contempt, the practiced authority. What was left sounded like what was actually there. I owe you an apology. Eve set down her pen. I spoke to you in a way that was. He paused, and she could see him selecting words with a care he had not previously applied in her direction. Unprofessional. And wrong. She looked at him for a moment. Then she nodded, once. Thank you, she said. He seemed to have expected more. A confrontation, perhaps, or an acceptance that required more from him. Her simple acknowledgement appeared to cost him more than either of those would have. He nodded back and left. Emily Foster, who had been sitting across the lounge with pretend interest in her own chart, watched him go and then looked at Eve. That's it, she said. That's all you wanted? Eve picked up her pen again. What else would there be? I don't know more. He was awful to you for 6 weeks. He apologized. Eve said it simply. People are capable of better than their worst moments. I prefer to believe that. She paused. Also, and here something shifted in her expression, the briefest possible warmth. Watching Dr. Voss with that HR file was genuinely more satisfying than anything I could have said. Foster stared at her. Then, slowly, she started to laugh. 3 days after the mass casualty event, General Calloway was stable enough for a brief visit. He was sitting up when Eve came for rounds. Margaret was still in the chair by the window, and she smiled when Eve entered, a smile with recognition in it, with warmth that had been building since the night of the hand kiss, since she had watched this young woman receive her husband's most sincere gesture of gratitude with the composure of someone who was simply, genuinely, not looking for acknowledgement. You look better, Eve told the general. I feel human, he agreed, which is a significant improvement over the alternative. His gaze was steady on her face. Sit down, Hartwell. She sat. I've been told about what happened in the trauma bay before they brought me in, he said. Before the surgery. The mass casualty situation. The other thing. She was quiet. Hayes pulled the full narrative from the nursing staff, he said. Not unkindly. Straightforwardly, the way he had always spoken to her. The way that had made her trust him in the field when she had been 19 and afraid, though she had never told him she was afraid because she hadn't been permitted to, and also it hadn't been relevant. I know what Aldridge said to you. I know what the environment has been like. It's being addressed, Eve said. I know it is. Voss runs a clean ship. She just needed the full picture. He leaned forward slightly, with the careful movement of a man whose chest was still healing. What I want to know, and you don't have to answer me, this isn't a debrief, is why. Why stay quiet? Why here? Why an intern rotation instead of? He gestured, a gesture that encompassed a career more commensurate with her record. He thought about this. She looked at the window, at the city outside, smaller from this floor than from the rooftop, more manageable somehow, the distances more visible. I was 22 years old, and I had spent 5 years in places where the primary concern was keeping people alive under the worst possible circumstances, she said. I knew how to do that. I didn't know, she paused. I didn't know how to do this. Civilian medicine. Continuity of care. Following someone through a diagnosis and a treatment and a recovery and watching them go home. That was the part one was missing. She looked back at him. I needed to learn it from the beginning. Like an intern. Because that's what I was, in those terms. Calloway was quiet for a moment. And Aldridge was an obstacle in the environment, she said. I've had worse obstacles. He smiled at that. It was a real smile. the smile of someone recognizing a shared language, the compressed, practical humor of people who had been in difficult places together and knew that the vocabulary of those places did not always translate. "You were 22 when you pulled that bone fragment from my pericardium," he said. "In a tent. In the dark. With a field kit and a headlamp." He paused. "I have thought about that moment more times than I can count. And I have never," his voice changed slightly, "never been able to adequately account for what you did, for what it cost you to do it. It cost less than you think," Eve said. And then, because it was true and because he had earned the truth, I was terrified. My hands weren't shaking, but I was terrified. "I know," he said. "That's what made it so extraordinary." The monitor beeped between them. The afternoon light shifted slightly through the window. In the corridor outside, the hospital moved around them, its endless, necessary work continuing. "What happens now?" he asked. "For you. I finish my rotation," Eve said. "I apply for residency. I take call, and I drink bad coffee, and I argue with attendings, hopefully slightly better ones, about differential diagnoses." She stood, smoothed her coat. "I become a doctor. The full kind. The kind that gets to see what happens after." "And if," Calloway said, with the careful precision of a man choosing his words, "there were other opportunities available to you? Positions more commensurate with—" "I know," she said. "And I'm grateful. And maybe one day." She looked at him one last time. "But right now I have a patient in Bay 7 who needs his PE anticoagulation adjusted and a resident who keeps getting it slightly wrong. And if I'm going to be useful in this building, I need to be the person who corrects that. Quietly. And correctly." She smiled. That real smile, the one that reached the steady eyes. "That's enough, sir. For right now, that's enough." She left. Margaret Calloway looked at the doorway for a moment after Eve was gone. Then she looked at her husband. "She's remarkable," Margaret said. "Yes." He looked at the door, too, at the space the young woman had occupied. "She's always been remarkable. I just hope this hospital is finally paying attention." 6 months later, Mercy General's trauma department had a new head. Dr. Patricia Voss had overseen the transition with characteristic efficiency, and the department was, by most measures, running with a degree of collaborative functionality it had not achieved in at least a decade. The nursing staff had submitted a rare collective positive review. The incident complaint log had gone quiet in the way that a fire goes quiet when the source of fuel has been removed. Eve Hartwell had applied for residency in general surgery and had received acceptances from 4 programs. She had deferred them all for 1 year, citing a research fellowship that she declined to specify in detail, which had caused her program coordinator mild administrative distress, and which was, in fact, a classified consulting engagement that certain people in the DoD found periodically necessary and would for some time to come. She had told Sarah this, mostly. Sarah had responded by buying her the best coffee the hospital neighborhood had to offer and sitting with her for 2 hours on the rooftop garden, listening to the parts that could be told and not asking about the parts that couldn't. This was, Eve had reflected, one of the better things that had ever happened to her. Ruth Dawson still ran the ER. Ruth would run the ER until she decided not to, and then she would probably continue coming in on her days off, because some people simply become the heart of a place and cannot be extracted from it without the whole structure changing. She had never mentioned the gloves. She would never mention the gloves. Some things were their own kind of memorial. General Calloway, who was recovering well and had returned to full duty ahead of his projected timeline, had declined 3 interview requests in which journalists wanted to discuss the intern who had saved his life. He felt that the story was hers to tell or not tell, and that the most respectful thing he could do with it was wait. On the last day of her rotation, Eve stood in the corridor outside the ER at 7 a.m., watching the morning shift begin. The fluorescent lights did their indifferent work. The morning staff moved with the particular energy of people starting something. Somewhere in Bay 3, a monitor beeped. Somewhere in the waiting room, a child was crying with the specific exhausted despair of a small person who had been sick all night and needed someone competent to tell them it would be okay. She pulled on her white coat, still slightly too large for her shoulders. She had never replaced it. She walked into the ER. Nobody looked up. Nobody paused in their work. Nobody paid special attention to the small young woman in the oversized coat who moved through the controlled morning chaos with the unhurried, steady efficiency of someone who had been in worse places and knew that here, in this building, with these hands, The worst thing that could happen was also the thing she had already learned how to face. She was nobody. She was a first-year intern. She was a ghost in white. She was also, under the code, under the silence, under the unremarkable surface of a woman nobody had thought to look at twice, the person who would stand between the worst possible outcome and the person on the gurney. Not because she had been ordered to, not because anyone was watching, not because the credit would be allocated correctly or the acknowledgement would arrive on schedule. Because the patient in Bay 3 was scared. Because the child in the waiting room was crying. Because the work was here and her hands were steady, and that had always been enough. The weight of silence is not absence. It is everything that has been held and chosen and carried without complaint. The 47 lives, the 3 tours, the bone fragment extracted in the dark, the 41 minutes at the open chest of a general, the 6 weeks of fluorescent contempt absorbed without flinching. It is the particular gravity of a person who knows exactly what they are capable of and has never once needed you to know it too. She walked into the ER. She was nobody. She was everything.